There are actually two options in placing the hair follicles with the FUE technique. One is the common way used in the older techniques as well, which requires the opening of small holes in our recipient area, and then the placement of the hair follicles with a specific forceps. However, there is a newer technique involving the use of a special device called the implanter, which allows us to place the hair follicle in a certain angle, in a certain direction, and at a certain depth, required to have not just the optimum result in terms of hair growth, but also to have a 100% natural effect. Post-operative course after an FUE session is largely uneventful and painless. And the patient can be motivated and return to his activities or her activities starting immediately after the procedure. As you understand, the main donor area for an FUE procedure is the scalp donor area, which, as we already described, extends from behind our ears to the occipital area. However, the minimally invasive way of the FUE technique allow the doctor to harvest single hair follicles even from other areas of permanent hair. For example, the face, the beard, or our body, mainly the chest, which has better quality hair than other areas. But virtually every part of the body with permanent hair can be harvested in an FUE session. The FUE technique solved many problems with its development, mainly covering areas like scars or congenital absence of hair in the eyebrow. So, eyebrow restoration with the FUE technique. Also, in rare cases, restoration of hair in the face, facial hair, like beard or the mustache. And most importantly, covering existing scars either from accidents or burns, or in cases of previous techniques of hair restoration, covering the scars produced by, for example, strip technique or the punch grafting. The FUE technique is proven to be a very successful and very efficient way to cover the scars from previous hair restoration procedures. Because let's face it, many people want to have now, or in the future, they might want to have in the future their hair style be very short. And by having a permanent and visible scar in the back does not help at all. So many people address to us, to our clinic, to restore exactly this problem, doing an FUE procedure to cover an existing scar from a previous procedure.